When you first decided to become a nurse, you might have thought of nursing as a general job title in a high-paying field. As you go through nursing school, you realize nurses can choose from a range of specialties, from midwifery to teaching. Some of the highest paid nursing jobs fall under the nurse practitioner category. Nurse practitioners are considered an advanced nursing profession that typically requires a Bachelor's of Science in Nursing (BSN) degree, if not a master's degree. So here in this video, we will discuss about the top 10 nursing jobs in 2021/2022. 10. Informatics Nurse. Computer and information technology are at the core of almost every industry, and healthcare is no different. The job of an informatics nurse is to figure out how best to harness the power of information technology in order to improve multiple facets of nursing operations and patient care. This can range from analyzing data, cutting costs, boosting patient care efficiency, and strengthening communication across entire hospitals and health networks. Dubbed as one of the top nursing careers in the industry, nurses who work in informatics may be known by a variety of different titles, including nurse informaticist, nurse informatics specialist, nursing informatics clinician, clinical analyst, IT clinical nurse. Informatic nurses make an average salary of about $102,000 per year, based on their location and level of experience. The top paid informatic nurses can make up to $188,000. Some of the highest paying states of informatic nurses are New York, Massachusetts, Washington, New Hampshire, and Hawaii. 9. Family Nurse Practitioner. Family nurse practitioners get to make long-lasting connections with their patients and see them through both good and challenging times. FNPs often work collaboratively with primary care physicians, which means they're a friendly and familiar face in their communities. A family nurse practitioner salary is earned with close, continual patient care. In some states, family nurse practitioners can operate their own practices and even prescribe controlled substances, giving them a high level of autonomy. A typical visit with an FNP might include consultation, assessment, and going over prescriptions. Demand for FNPs is growing and will continue to do so for the foreseeable future. If you go this route, you could land the median annual salary of $109,240, potentially with ease. In time, a salary in the top 10%, allowing you to cross $127,256, may even be possible. 8. Nursing Administrator. If nurses are the beating heart of the healthcare industry, think of the nursing administrator as the signal that keeps that heart rhythm beating. Nursing administrators are responsible for managing the nursing staff. They are also in charge of scheduling, resourcing, and many other nursing functions that are essential to the smooth operations of a hospital or clinic. This job requires both a keen understanding of a nurse's responsibilities and a specialized knowledge of medical office administration. Because their role embodies the perfect balance between those two worlds, nurse administrators hold a vital position among the hospital staff and their patients. Since this role is so critical, nursing administrators can earn a pretty penny. An annual salary near $94,396 is close to the average. 7. Pain Management Nurse. As a pain management nurse, you'd help patients overcome post-operative pains or deal with chronic pain issues. Pain management nurses usually work closely with larger medical teams, allowing them to identify the causes of discomfort and work up with viable treatment plans while reducing the likelihood of addiction. Pain management nurses work in a variety of settings, including hospitals, surgical centers, and pain management clinics. Often, yearly salaries around $125,284 are common, with some earning over $135,545. 6. Neonatal Intensive Care Nurse. For anyone who would like to spend their time taking care of babies, consider a career as a neonatal intensive care nurse. While the work can be challenging, as many of the infants will have serious health issues, it is also very rewarding. Plus, you can earn the median annual salary of $64,567, or if you make it to the top 10%, pay above $101,000 is on the table. 5. Certified Nurse Midwife. While there are many types of nursing jobs and salaries, certified nurse midwives provide women with specialized care throughout the course of their lives. This may include pregnancy, family planning, or general care. If you love obstetrics of labor and delivery, then this could be the ideal career path for you. Some CNMs find employment in clinics or hospital settings. Others might work in OB/GYN offices. A number of CNMs even start their own practices. At the heart of it, certified nurse midwives specialize in bringing life into the world. As with many nursing careers, your educational path isn't always the same. To excel in this field, you will likely need a master's degree in nursing with a specialization in midwifery. The median annual salary of a certified nurse midwife is about $94,000 pay scale in the United States. Their salary can range anywhere from $77,000 to $117,000 per year. Ultimately, their annual pay is dependent on factors like location, employer, experience, bonuses, etc. 4. Psychiatric nurse practitioner. A psychiatric nurse practitioner on mental health nurse practitioner is arguably one of the highest paid nurses in the US. Those who are interested in mental health could find the specialization to be an incredibly rewarding one. Psychiatric nurses work under the direction of a psychiatric physician and advise patients who have mental health disorders. Depending on your employer, you might help patients who suffer from depression, schizophrenia, bipolar disorder, or other mental health issues. As a psychiatric nurse, you may also be able to prescribe medication and assess or diagnose patients. To successfully break into this profession, you will most likely need to earn your master's degree. A specialty in psychiatric nursing would serve you even better. Of course, you will also need to obtain your RN license. The need of PMPs is rising. At times, there are also opportunities to specialize in specific conditions, including specific mental health disorders or substance abuse. In this field, you can earn about $106,690 a year in most cases, potentially leading to an annual salary of $126,406 or more. 3. Clinical nurse specialist. For anyone who would prefer to specialize, becoming a clinical nurse specialist (CNS) can be a great choice. Often, a CNS is considered an expert in their niche, offering high-quality patient care in their specialty. Plus, a CNS may not only treat patients but could participate in research as well. That makes it a strong choice for anyone who wants to shape the future of medicine. And along the way, a salary of $106,797 a year or more is certainly possible. But if you join the top 10%, you could end up making over $126,255 annually. 2. General nurse practitioner. General nurse practitioners (NPs) are considered to be one of the top nursing careers. In this role, you could perform duties that are similar to those of a family doctor. NPs have the education and skills to examine patients independently. They may also prescribe medications, diagnose illnesses, or recommend alternative treatment options. In addition, they can interpret diagnostic lab tests. While some NPs work in hospitals, clinics, or nursing facilities, others might choose to open their own practice. Usually, general NPs aren't overly specialized. They may see patients with all kinds of conditions, which can keep the work engaging. In exchange for their broad knowledge, they can earn salaries around $109,820 a year, though the top 10% of the earners may even cross $152,160. To become a nurse practitioner, you will need to earn a MSN degree as well as your nurse practitioner licensure. Check your state requirements. For general nurse practitioners, an MSG degree is considered the minimum degree requirement. 1. Certified Registered Nurse Anesthetist. Certified RN anesthetists provide anesthetics for millions of surgical, obstetrical, and trauma care patients every year. In fact, nurses have held this responsibility for many ages, stretching back to when they first began administering anesthetics on the battlefields of the Civil War. It doesn't matter if the procedure is open heart surgery or root canal or a birth. Nurse anesthetists collaborate with surgeons and anesthesiologists across all medical fields. In many rural hospitals, CRNAs are the only provider of anesthesia, making their role more vital than ever. And for these reasons, the Certified Registered Nurse Anesthetist is the highest paid nurse. The median annual salary for CRNA comes at $174,790, essentially making these professions the highest paid nurse around. Plus, the top 10% can earn much more, including a salary in excess of $208,000 a year. Thank you guys for watching. If you want more videos like this, make sure to like the video and hit the subscribe button, and we'll see you in the next video.